Well, I'm going to talk today about anal problems. Anal problems are very common. They include a variety of diseases like hemorrhoids, fistula, fissure, and bleeding from the anal verge. Now, from all of these, usually pain occurs mostly from the anal fissure. Anal fissure is very painful, especially at the time when patient goes to the toilet and has defecation, when the stool passes through the anus, which has fissure. Fissure is a little wound at the end of the rectum in the anal opening, and every time he passes stool, it will hurt and it will be burning, and also it will be burning after defecation. So it is very annoying to the patient, and he seeks advice sometimes as emergency basis. All what we have to do is to do a little bit of anal dilatation by inserting the finger, which is lubricated, of course, in order not to hurt the patient, or do surgery, which is also a very easy one, which takes only 2 to 3 minutes, because what happens is that when there is a fissure in ano, there is pain, and when there is pain, there is spasm, and the spasm will prevent the fissure from healing. So we have to break the cycle by doing dilatation, which will oppose the spasm, and when the anus is dilated, it will heal by itself, by advising the patient to make sitz bath every day, and it will heal by itself. Now, the second thing that makes the patient comes to the emergency room complaining of pain from the anus is a thrombosed hemorrhoids. Hemorrhoids are, or piles, are prolapsed veins. It's like the varicose veins that occur in the legs. These are varicose veins in the rectum. When they get dilated from straining, from chronic constipation, and so on, there might be some thrombus or clot inside the prolapsed vein, and this will cause a very painful area. So all what we have to do on emergency basis is to slash that thrombosed area under, of course, anesthesia, and get the clot out, and the patient will feel okay. Now, I will advise that no disease or no affection of the anal problems, as I mentioned, hemorrhoids, especially hemorrhoids, should be treated before we do proctoscopy to rule out any disease that is responsible for the occurrence of the hemorrhoids. And of course, I mean ruling out a tumor or growth that is located above the hemorrhoids and causing the hemorrhoids to be enlarged. So I will advise everybody with an anal problem to undergo, first of all, digital examination by the examining doctor, and then later on sigmoidoscopy to look into that area and rule out any problem causing those diseases. Thank you.